Hello, I'm Dr. Ivy Peltz,
And I'm Dr. Eric Studley.
and we're the founders of Doccupations, an online algorithmic dental job matching service. We match dental job seekers with dental employers.
So we started something a few months ago simply because people would call in, ask us questions, ask me questions in regards to everyday practicing.
Right, and we call it Dear Doccupations, and here we go. We pop up whenever we feel like it, and hopefully you pop in. So here is our pop-up. Dear Doccupations, the patient needs treatment that is above my skill level. The patient says he will not go anywhere else. What do I do?
Well, before I answer the question,
Yes.
I have to say we have to give the disclaimer
Yes.
that these opinions that we will present at this very next moment are the opinions of myself, Dr. Eric Studley, and Dr. Ivy Peltz.
Yes.
So
and our opinions alone.
So if necessary, if anything further, please consult with the proper attorney that could help you answer these questions if anything is, needed anything further. So in regards to this, and this is a question that comes up so often, and even myself when I was a young practitioner or even, a seasoned practitioner, and I'm sure yourself, still practicing, patients come in. They might come in, number one, as a referral. They might come in because we accept their insurance. They might come in because of convenience, or the fees really fit their monetary structure.
But they're now in your office.
And now they're there.
Mm-hmm.
And we do a full exam, a comprehensive exam, and radiographs, medical history, and the treatment that the patient needs might be a little bit above our skill level.
Mm-hmm.
It might be
no shame in that.
No shame in that whatsoever. And really, that is at the point where you show that you really are a skilled professional
and a caring practitioner
by telling the patient, you know what, this level of treatment would be better served if you saw, AKA, a specialist.
Yes. For example, I'm going to give a very quick example. Which is now, I used to do a lot of endo in my own practice, but at this point, with the microscopes and everything else that endodontists are using, I actually went to my endodontist the other day and I said, I'm Fred Flintstone and you're George Jetson. And for anybody who doesn't know what those references are, please look them up and enjoy a few cartoons on us.
So the takeaway on this is, you are actually showing better skill. You're showing yourself as a better professional by not treating a patient that would be better served with someone else who has a much higher level of skill, regardless of the fact that the patient may say, but I can't afford to do that kind of dentistry. When if that kind of dentistry is the only dentistry for the patient,
and there are always alternative treatment plans. So if you can't do the treatment and the patient doesn't want anyone else to do it, then you may have to alter your treatment slightly to accommodate the patient. But the mistake would be to try to take on treatment that's above your level of skill, because then you're going to wind up wishing that you hadn't. And so will the patient. And you won't have done anybody a favor in the end.
So hopefully we taught you something in these brief couple of minutes.
Feel free to add any new questions into the messages, and we will answer them at a future date. And please go to www.doccupations.com and join us. We will help you find your next dental job or your next dental employee. Good night.
Good night.